Hello, everyone, and thanks for joining us for the 20-minute Masterclass in Outbreak Prevention. I'm Tori, and I'll be facilitating today's webinar. After the presentation, we'll open up the floor to questions, so please use the Q&A box on the bottom right-hand corner of your screen to send in your questions. Just be sure to send them to me or the host so we don't miss it. I'd now like to introduce our presenters for today's session, Barley, International Infection Control Specialist at Clorox Canada, and David, our Cleaning, Hygiene, and Sanitation Director for Eastern Canada at Bunzl. Over to you, Barley and David.
Thank you very much for that kind introduction, and definitely thank you everyone for taking time out of this very busy cold and flu season. And we're looking forward to sharing with you guys and having a whole bunch of conversation and questions after the fact. So just to get started, how does cold and flu season actually affect your business? Let's look at some facts. Cold and flu season actually impacts 1.5 million workdays that are lost each year in Canada because of cold and flu, as well as outbreaks. Canadian businesses themselves actually lose approximately $1 billion. And the season can go from as early as October into at least the last day of February, with at least an adult catching 2 to 5 colds per year. And that also has to have major negative outcomes. So you end up seeing about 300 to 400 outbreaks of norovirus that are reported by Public Health Agency of Canada. And talking in particular about the flu, it's a little more dangerous than you might think. And what that actually does is it opens up a lot of people to a bit more risk than you might think. So between 2,000 to 8,000 Canadians die from the flu or associated complications of flu each year. The flu itself is especially dangerous to people that have weakened immune systems, children that are 3 years old and under, as well as people that are over 65 years old. The flu virus can live on surfaces for up to 24 hours, putting everyone at risk that may come into contact with those surfaces. And in addition to flu, there can be certain other emerging pathogens, and coronavirus being an example of that.
Let's talk a bit about that. An emerging pathogen is something that starts to show up and hasn't been seen before. In the case of coronavirus, this is actually called a novel coronavirus because they haven't seen it before. These can cause acute respiratory infections that can be difficult to treat. And when that happens, people end up having many problems and show up to many different healthcare institutions. They can spread easily and spread widely throughout the public, and this can cause so much concern. In particular, it can affect the elderly and other people that are of varying immunities. And these pathogens actually need special strategies that are unique to what we might be used to doing every single day. To contain these, you actually need to then do different things, and it requires your facility to have the proper prevention strategies through proper facility cleaning and personal hygiene. And this is something that we're going to talk a bit about over the next couple of slides, because I think it's very important to be able to learn this. So what happens when you're not sure if it's a cold or if it's a flu? Here's how to tell the difference. And I think this is very important because right now, as we are looking at people in the cold winter months, people tend to have so many different symptoms. But the easiest way to really look at it is if you look at the symptoms that are on the screen here, and you look at the tab that has cold and the tab that has the flu, you will notice that the flu in the green is actually having more of these symptoms that are very difficult and very harder on your body. So you're seeing more fevers, you're seeing more aches and pains, and you're seeing some of these things that like really end up causing you to be in the hospital. So that's really a good, narrow, small, quick little way of actually knowing whether it's actually a cold or a flu. I'm going to pass it on to Dave, because Dave right now is going to talk a bit about how you can keep the flu out of your workplace and some of the ways to contain and other strategies.
Thanks, Barley. I guess, we really need to focus on the germ hotspots in your particular environment, and they're common to a lot of our facilities, telephones, touch points in restrooms, elevator buttons, staff kitchen areas, our computer keyboards, door handles, meeting rooms. All these have some commonality to it, and they're the areas we really have to focus on trying to keep sanitized and disinfected if we're going to stay ahead of this. So we want to look at what we can do to keep an outbreak from taking over our workplace, and there's some good strategies here. Probably some of the best practices and involve environmental hygiene, let's keep our facility clean and do the core cleaning on those hot spots that we touched on there on a daily basis. You can augment it with other tools like electrostatic disinfecting, which is a great emerging tool in defense against these things. The personal hygiene is the biggest thing, and I think the power here is in educating the staff and the visitors how they can avoid getting sick, making good personal hygiene choices for the people in the facility, and as well, making sure that all your dispensers are filled, your toilet paper, your hand towel, your soap are all critical things to make sure that we're not running out, and as well as your hand sanitizer. The barriers, right, from that standpoint, we can use PPE, gloves, masks, tissues, and as I say, personal protective equipment where required to help keep our cleaning staff from infection. And then another area that's often overlooked sometimes is food safety and hygiene there. And we can use disposable items, cutlery, things of that nature that avoid spreading things from cross-contamination, and advise staff to make sure they rewash reusable items very thoroughly, right? Make sure that you clean up after yourself. So let's look a little deeper at some of the best practices around environmental hygiene. We want to stop that spread of infection, which Barley touched on earlier. The key steps from a cleaning and hygiene standpoint is to amp up the facility cleaning and disinfecting, focusing on those hot spots that people touch. Make sure that disinfecting supplies are available to all staff. And what I mean by that is a lot of times people are responsible for keeping their own personal area clean, and disinfecting wipes are a critical part of that, and personal use of hand sanitizer when you can't wash your hands. Use trusted cleaning products, and what I mean by that, Health Canada provides DIN registrations to appropriate disinfectants. They're going to give you the kill on the viruses that we're finding in the workplace, and of course, obviously, these ones that are circulating now with Corona and Influenza B are ones that we're very concerned about because they can really wreak havoc. And use the right cleaning method, right? This is always something we try to reinforce. Your staff should receive ongoing training and updates on how to deal with these things like coronavirus. It's good to be prepared and be proactive in that area, and reinforce that we want to pay special attention to disinfect the surfaces. And if you're not sure or you're looking for information, our good colleagues at Clorox Pro or your Bunzl Cleaning and Hygiene representative can help give you guidance, and we're happy to come in and give you some recommendations if you're not sure. Implement, specific cleaning procedures as well for bodily fluids and things of that nature. There's a biohazard protocol that we've developed, and you can we can make it available to you, and it's important that people are trained and comfortable on how to deal with all those things, and as well that they wear the appropriate PPE, the N95, the gloves, all the things they're going to need to deal with, say, a large bodily fluid spill or something on a carpet, right? So it's critical that you understand how to deal with that. How can we be sure when we've got some really maybe challenging or difficult clean areas to clean? And how do we clean things like keyboards, telephones, and other equipment, electronic equipment? Well, we've got a really great tool in the toolbox now, which is where I've been spending a lot of my days, and it's with electrostatic disinfecting, and it's doing amazing things on the front line. And it's also a great tool as a preventative thing on a daily basis. We're doing it in education, healthcare, government. This week we installed equipment at the major airports in Canada, and I'm proud to say it'll be the first thing that receives the plane at CFB Trenton on Friday morning when the Canadians arrive back there from China. So we're very proud of the work we're doing there. If you're not sure about how electrostatic disinfectant works, it's really giving you full coverage. It's getting chemistry to areas that we can't traditionally get it to with our conventional cleaning methods. It uses less solution, which is a really great story. it works considerably faster, and you can do somewhere between 18,000 and 22,000 square feet an hour in it. And so it's a very effective tool, especially in these challenging times. So, if you want to hear more about that, certainly, again, talk to your Bunzel. Now I'm going to turn things back to my buddy Barley.
Perfect, Dave. Thank you very much about that. What about personal hygiene? I think this is a very key consideration because I think personal hygiene plays a big role in terms of how you can actually prevent the spread of some of these infections. As you might have already heard a lot in the news right now, following coughing and sneezing etiquette for this time of the year is critical. You want to make sure you cover your mouth and cover your mouth and nose with a tissue. Cough or sneeze into your upper sleeve or into your elbow, they would often say, and always wash your hands afterwards. You want to also make sure that you're getting a flu shot around the time of the year because that's when the flu is actually circulating a lot, and stay away from people that are not well. And in your case, if you happen to be unwell, stay away from work and other places where you can make other people sick, because it's well known that people that are actually unwell tend to pass on the infections to other people at work. So that's something that you definitely want to be thinking about.
Thanks, Barley. And I think it brings us back to probably what is the most critical piece in any of this, whether we're dealing with new emerging viruses or the flu. The biggest thing that people can do is something they have total control over, and that's wash their hands, right? Preventing the spread of infection with proper hand washing and not touching their face, as we call it, the T, their eyes, their nose, their mouth. Is a critical piece, right? And as I say, 95% of the people in the world don't wash their hands correctly. And some of the common mistakes is people will not use soap. They think that it's not going to benefit them. And another big one is not washing long enough. As we often say in the trade, sing the birthday song to yourself. Keep singing, and as long as you're singing, you need to be using that mechanical action with the soap and making sure you're cleaning your hands and getting around your nails and cuticles. Or a lot of people choose not to wash at all, which is a deadly practice. You're guaranteed you're going to share something with people. Hand washing, you need to use soap and water. You need to wash for at least 20 seconds. And then when you can't wash, hand sanitizer is an option, but it's not a replacement for hand washing. That's a critical piece. And then another big part is covering your mouth and nose when you cough or sneeze. And the ideal situation is to do it into your elbow, and then not into your hands, because if you do it in your hands, then you share it with other people. We've included in this how to safely remove some of the disposable gloves as well too. That if you do that, and that's a critical piece. I'm not going to go into the detail of it, but it's worth a review if you're wearing gloves, how to properly take them off. I say this because in my 30 years, I've seen people take them off in all different kinds of formats, and it's so critical to take them off properly and then immediately get to washing your hands. From our standpoint, we can help you with your hand hygiene and making sure that your washrooms are clean and certainly well stacked with our washroom monitoring program. We have all kinds of information that collects data and helps us keep ahead of it, keeping the washroom clean, stocked, and as well sort of measuring hand compliance to washing. So, it's a great tool. If you're interested in that, please talk to your Bunzel rep. Barley, I'll get you to take the next slide, please.
Perfect. So the question is, are there other ways to prevent an outbreak from taking over your facility? And I think there definitely is. And what you definitely want to do here is you want to start with an outbreak management plan. And there's a couple considerations to think about here. And here are the 4 steps to plan for an outbreak. What you want to do is you want to establish an outbreak management team. And this is a special team of multiple stakeholders that you're going to bring in if you eventually end up having a problem. You want to conduct a risk assessment so that you can be able to determine if you really are actually going on and you're having an outbreak at the time. You want to be looking at the number of people that are calling in sick, the people that are not coming into work, the people that might be affected in your facility. All that really creates an infrastructure for you to be able to see what is the cost and what is the control measures that can be relevant. Then you want to plan your communication. How will you communicate stuff? How will you talk to your outbreak management team players? How will you actually go about sharing all the necessary communication pieces? And will people know the things that they have to do? In keeping with that, to prepare for unexpected absences, right? You want to now anticipate what happens if the person that knows how to control all the infrastructure is actually unwell. How do you continue to have a reliable organization that can continue to function? And it's very important to know the different stakeholders that you can work with. So we've given you a hint there on who should be on an outbreak management team. This is a very important slide because it helps you to remember some of the key players that you can work with and that can help guide your process. So it's very key to that process. Let's say you tried all that you can and unfortunately an outbreak comes knocking at your door and here's an outbreak and then you now have to deal with it. In that case, here's some critical steps to think about. Not all outbreaks are outbreaks. And I think that is very important because there's been many a time even through my career where we've actually gone in to manage an outbreak and it turned out that the cases actually don't even actually have symptoms or they actually don't have the similarities. So you want to make sure you verify the number of illnesses that are related to the absences and make sure that they meet your outbreak criteria. You then want to verify a diagnosis. You want to make sure that the person actually has the thing that you're worried about. And that's why you might be seeing a lot of cases in Canada where they're looking at the coronavirus and they might call it something and then eventually they'll call it confirmed or they'll say it's not on a case. This is part of that whole diagnosis piece and it's very critical as you're establishing whether you have an outbreak or not. Then you want to set a case definition. You want to decide, hey, listen, what are we actually looking for? That way you're looking for consistently the same thing. That way when a person comes in through your facility or if somebody has a particular symptom, then you actually can know exactly what it looks like. So using again the coronavirus example, right now the case definition that's being used is a person that actually has traveled to Wuhan, China, and it's continuously being changed eventually to expand into people that have been to Hubei province, and eventually maybe they might say people that have been to China, period. But then at the end of the day, that helps you define what your case definition is. Then in the next pieces, you want to actually have your control measures set up. That's the key part. You're having your cleaning, you're having your PPE, you're having all your disinfection protocols actually being done. And then you want to have a system to evaluate, testing, checking, and monitoring for symptoms and signs. That way you do not miss anything and you're having all the due diligence of the work that needs to be done over the day.
Okay, thanks, Parley. And I guess the purpose of this exercise, we now need to ask ourselves, are we prepared to deal with the impact of an outbreak should we incur, right? Are we prepared to fight this, it be Corona? And I think the idea today is to give you some things for your toolkit and make sure you are prepared. We're going to be sending you a copy as a part of participation of our outbreak prevention guide, which we put together that covers a lot of this. There's other tools we can go to like electrostatic, disinfecting, our digital washroom monitoring, and as well you have the ability, which I think is the most critical piece here, is to promote hand hygiene education. You can download here as part of this today our hand washing program guide. So we really want to thank you for taking time of your busy day to join us, and we're going to open things up for questions.
Super. Thanks, Farley and David. Just a reminder, if you have questions, please put them in the Q&A box at the bottom right-hand corner, and we'll just jump right in. Do products like Lysol disinfectant spray work?
So that's a great question, and if you're watching the news and if you're looking at some of the Facebook social media posts, that's definitely a lot of big questions that are being asked. As Dave eloquently put earlier on, you want to make sure that the disinfectant that you're using has a DIN number on it. Once it has a DIN, that's the first part of it. The second part of it is you want to make sure that the disinfectant that you're using with that DIN has particular claims to kill the pathogens or the germs that you're worried about. That becomes a very important piece. So I cannot speak to particular Lysol products without actually having looked at the DIN, But I think the key process then becomes to actually, regardless of whatever the brand name is, just take a look at the DIN and look at the kill claims, because that is a requirement of any product registration within Health Canada. I don't know if
yeah, and I guess I would add the other critical piece to look at when you're examining that information is what is the required dwell time or contact time to kill. It varies. In disinfectants in Canada, we have disinfectants that will do the job in 60 seconds. The electrostatic disinfection works in 2 minutes, which is outstanding. And then we have other products that it might take 10 minutes. And then there's some other products, when you read carefully, you'll see they fall short. They're not going to give you what you need in dealing. So Barley's point is you need to make sure you've got the right product to tackle the job.
Why does hand sanitizer not substitute hand washing?
Well, I think the critical piece of this is hand sanitizer will help to control the germs on their hands initially, but it's the mechanical action of using soap and water that really helps to clean the hands off and to bring them back to a point where they're clean and they're not going to transmit things. You just don't get that by applying hand sanitizer. Quite often it's overly used, and people actually create a barrier on their hands with hand sanitizer that needs to be cleaned off to effectively make them clean.
And I think the other thing to add to that point too is there's certain pathogens like C. difficile where unfortunately the hand sanitizer has not shown to have that much of efficacy, so you actually need to resort to washing your hands with soap and water, because it then rids your hands off those dangerous pathogens.
Great.
Very good point.
How long does the coronavirus live on a hard surface?
Great question. So coronavirus is a whole bunch of viruses, right? So if we're talking about coronaviruses, some can live up to 24 hours on the surface and longer. Some can live only up to 2 hours. So depending on the type of coronavirus. The one that is being in the media right now is a type of coronavirus, but that exists as part of a whole bunch of viruses as well. That can range from causing just normal colds all the way to like serious infections like what we're seeing now with the novel coronavirus. That being said, they range in time, how long they stay on the surface. You definitely want to be actually having processes to disinfect at least more than once a day, because that helps you break that chain of infection. And I think that's where most people struggle, because they might not have the technology or the methodology to actually do that proper disinfection to get to those spaces that they need to.
Yeah, and that's a critical part of that, Barley, is you need to ramp up your cleaning on those touch points more than once a day. It's not enough to deal with those surface once. You need to try to get to them multiple times over the course of a 24-hour period if you're really going to control things.
Great. What hand sanitizer is recommended for schools from JK to 12? Can non-alcohol, non-scented be used?
It's my understanding that the Ministry of Health in Ontario recommends that they have to use alcohol-based hand sanitizers. There was a use of quaternary ammonia compound sanitizers a number of years ago, but they're not proved to be scientifically effective as the alcohol, and the Ministry of Health recommends that. And they also, I think, you find out that we've been working really heavily on trying to educate kids from JK on about the importance of hand washing and the proper hand washing, and to use hand sanitizer when necessary. And they're very informed and they understand. So as I say, at the end of the day, we need to get them to wash their hands.
AHS considers bleach as a disinfectant. Is it?
Great question. So bleach does have disinfecting capabilities. What you always want to be thinking about when you're using your bleach disinfectant is the concentration that you have it at. Because ultimately what Health Canada does is they give a generic bleach acceptance at 1 part of bleach to 10 parts of water. So that gives you an ability to lace it and claim. That being said, you still want to be looking at the DIN number on your product. You also want to be following that particular product manufacturer's recommendations for the pathogen that you're actually looking at. And I think AHS is being referred to as actually a healthcare system. I'm assuming it's Alberta
Health Services, yeah.
So if it's Alberta Health Service, I think what you also want to comply with is your infection control practices, given that you're a healthcare facility. So there's expectations in terms of the concentration that you're using and adherence to contact time, in addition to following the manufacturer's recommendations for the proper disinfection. And if you do that, then you're meeting the requirements that are set forth.
Great. Is Quat a good disinfectant?
Well, I guess I'll tackle that. Quats have been around for a number of years, and there's been a number of generations of Quat disinfectants. Again, each region of Canada has certain things that they prefer. I can speak to Ontario, where I spend most of my time. Predominantly, a lot of the healthcare in both acute, long-term care, and in education use accelerated hydrogen peroxides, a lot of them on a daily basis. And as well, but there are great emerging Quat technologies that are in use. And in fact, the electrostatic disinfection solution that we have approved from Health Canada is a dual Quat with a 2-minute full broad spectrum kill, and it's compatible with all the aforementioned disinfectants out there, whether it be HP, bleach, or an existing Quat.
And I think just to add to that point from Dave, I think you want to be actually looking at a situation whereby you are following the recommendations of the manufacturer. Quat, just like bleach-based products, just like hydrogen peroxide-based products, are listed as disinfectants according to Health Canada. And each of those would need to meet the requirements of what you're actually doing, and you would also need to follow the safety data sheet related to that. So we can see some questions related to some safety considerations, and we can tackle those as they come up as well. But I'll pass on to Dave.
Well, the only thing I would add, and not to generalize it, but a lot of the Quats traditionally take more contact time or dwell time to kill. Right, they're closer to 10 minutes, which is, we have a lot of products in our bag of disinfectants that work a lot quicker and faster, and it's just not always conceivable to keep a surface damp or wet for 10 minutes to get that 12 time with the Quat. Thank you.
Is there a shortage of face masks in North America?
I guess I'll speak to that. Yes, there is a shortage of face masks, and I think what's happening now is the mask manufacturers are holding masks and releasing them to critical people that need them. I confess I was involved with one yesterday where we had to have masks released as part of a medical requirement, and so the healthcare institutions, the people that are in long-term care, those people are the ones that are going to get the masks initially, and on the front lines where I was providing masks for CFB Trenton yesterday for receiving the Canadians coming back from China. They're going to get the masks, and so from that standpoint, it is challenging for personal people to try to get them. I want to just touch on this. A lot of misconception is that the mask is a critical piece to protect you, and you see people wearing them, I think, with sort of a false sense of security. The reality is the mask is designed to contain things. So if people are infected or sick, they're the people that need to be wearing the masks, and that's the critical piece, as opposed to a barrier or protection thing that people, it gives them a sense of security, but the reality it's not doing much. But yeah, they're in short supply. Washing your hands is still the most critical piece that they can do, more than worrying about a mask.
Great, thank you. Clorox versus PCS disinfectant, is there a difference in kill times?
That's a great question, declaring conflict of interest, obviously, working for Clorox. But what I would like to say is, I think, depending on the pathogens that you would like to kill, you definitely have to look at those specific pathogens. So I can't speak to the PCS products in this particular case without knowing also what pathogens you're trying to kill. So I would say this is one of those opportunities that I would recommend taking advantage of a Bunzl rep or a Clorox rep that can come to your facility and help you make a decision. But the way we normally approach, when I'm called into a facility and we're consulting and we're looking at a solution, we typically look at the pathogen that the person wants to kill, and then we vet against their current solution that they have, and then we look at where the Clorox might have a solution. And sometimes we might not even recommend a Clorox solution necessarily because it might be something that we cannot cater to. Because at the end of the day, we're in the business of trying to make sure that every Canadian is safe and healthy. So we're always looking at what is better, but it needs entire information to make that decision. And in this particular case, without some of those information sources, I cannot really decide for you.
That's well said, Barley. It's about what's best for the customer. It truly is, and that's our intention.
When planning for staff cleaning routines, what is the ideal or optimal frequency recommended for touch zone cleaning when enhanced protocol is in effect?
Okay, sorry, can you just sort of I'll try to break that down. There seems to be a couple of questions in there.
When planning for staff cleaning routines, what is the ideal optimal frequency recommended for touch zones when enhanced protocol is in effect?
So I can
okay, yeah, go ahead.
So what you want to look at, once again, is it depends on the pathogen that you're actually dealing with, right? So if you're dealing with C. difficile, for example, in the province of Ontario, the requirements are you clean twice a day with a sporicidal agent, which is a product that can kill C. difficile. If you're dealing with influenza, the expectations of typical outbreak management is you're at least going in 3 to 2 times a day, depending on the surface that you're actually dealing with. The Provincial Infectious Disease Advisory Committee, PIDAC, has a very good document that actually gives you the frequency by surface. So we can share that out with the share out. But it's definitely a guidance document that looks at every single surface and stipulates how often you have to go in and wipe those surfaces. Last but not least, depending on your unique setting, you have to look at unique value proposition. So Dave and I were at a facility that's an extremely large facility, it's a transportation facility, and what they were asking us is how often they have to go in. But their problem that they were facing is that it's a busy area with many people moving through there. So in that case, we had to customize a solution that worked for them, and then we laid in the necessary auditing that were allowed to justify whether that work is good or not. But ultimately, it now totally depends. But I can open up to Dave if you've got.
Well, no, I think you've covered it, Barry. And then one thing reinforced again is PIDAC is a great guideline to identify what's considered best practices in those areas. It's not always, you can't always follow it because of your course of business and traffic and all those other things, but it's a good place to start.
Are disinfectants altered or enhanced by using an electrostatic process?
Well, that's a very good question. I really can't speak to other things in the marketplace. I can speak to what we know and our learnings over the last 8 years with electrostatic disinfectants. It's a very critical piece to pair the right chemistry with an electrostatic. And what Clorox has done is they've really taken the chemistry and refined it so that we have a product, number one, that allows us to enter immediately, re-enter immediately after use. There's no scent, there's no odor, where some of these other products that may be being utilized out in the marketplace may have scent and re-entry things, and in some cases they haven't been vetted, so we're not actually haven't been measured as to what's in the air, and that's a critical piece with our particular program. It's been looked at by Health Canada. We have the Health Canada approved disinfectant that's paired with the unit that effectively delivers the chemistry every time to the surfaces, and again, it's also ULC approved, which is a critical piece because you want people to be safe when they're doing this.
Great, thanks, David. Do alcohol-based chemical cleaners kill viruses such as the coronavirus?
So that's a great question. Once again, I think when you have a disinfectant, like alcohol-based disinfectant, you want to be actually looking to see if it has a DIN, and then if it has the necessary kill claims that are listed against the coronavirus. What Health Canada does is they look, especially when there's emerging pathogens that we just talked about, what they look at is they look to see when something is really new, whether it can be killed by old disinfectants, and Health Canada simply put it as no, that's not the case. You have to have special requirements, and one of the things is you need to have what they call a broad spectrum virucidal kill, and what that allows you to do is you've been tested as a disinfectant to kill some very difficult to kill pathogens. Only then are you able to lay claim. What we typically see with alcohol disinfectants is they quickly dry, and they might not have the necessary ability to dwell and stick and kill. As a result, that limits their ability to work. But once again, what you want to do is if you have an alcohol-based sanitizer or even any kind of sanitizer or disinfectant, you want to actually look to see if it has efficacy against what you want it to have. And the best place to start is with your DIN and with your label of your manufacturer's recommendation.
Great. Does the electrostatic system require wiping dry after application?
No, that's a great question. And again, our approach is it's a tool. How you choose to use that tool and effectively either disinfecting, sanitizing, or augmenting your existing procedures, it really is up to you in putting it in play. But when it's properly applied, it applies to a surface and it's completely dry to the touch in 2 minutes. And coming out at 30 to 50 microns out of the wand, it's basically naked to the human eye when it hits the surface and wraps around it. So there's nothing left. And I can tell you I've been watching it very closely for 6 years now with the current chemistry, and there's no issue with residual as well, building up on the surfaces.
How often would electrostatic sanitizing be recommended in a facility?
Again, we'll go back to what Barley touched on earlier with PIDAC, depending on what we were trying to tackle and what would be considered the best practice around attacking that pathogen. Ideally, we've had some great success in education and long-term care in the last number of years where people are using the tool daily as a preventative tool. We have people that use it very successfully as outbreak tools and put out noro outbreaks in the space of a couple of days. We've had staph infections with both professional and college sports teams that we put down in under 2 days, and we've had public health come in, go, I don't know what you did, but that's incredible because we've never seen things handled so effectively so quickly. So their words, not ours.
Great. And could we go over the greatest hotspots, touch points for germs?
Sure. We touched on it in our earlier presentation, but there are the key spots for germs. Obviously, they're the phones, they're the door handles, they're the light switch. There's certain, table points that are activity and commonplace in those staff kitchenettes, in the coffee rooms, in those areas, and at your own personal space, right? Your own computer, your own keyboards. That's why we touched on earlier. It's critical. It's a really good tool to have disinfectant wipes at that space and clean your station down. I had someone I gave some to this week, and they commented, and they're a very clean person and very fanatical about it. They couldn't believe how much came off their keyboard and things when they wiped it down afterwards. And very, very good hand hygiene, and they use hand sanitizer all the time. So it's critical to keep ahead of those things and keep that in mind when you're going into a room. I confess I'm not a germaphobe, but I'll hook my elbow around a door or use my foot, or I take my paper towel that I just dried my hand with and I open the door handle and I deposit the paper towel, or after I get outside the washroom, things of that nature. It's just good common sense practices to have.
Great, thank you. We've had a number of questions regarding hydrogen peroxide and how effective the use of that is for flus and viruses.
So that's a beautiful question, and I'm liking the theme of these questions, in particular around disinfectants and whether they are in a group of stuff. So in this particular case, it's viruses and colds and such. So I think, once again, I'll stick to the same talking points and pretty much say this. Not all disinfectants are created equal. So whatever you have, you want to be looking at your DIN and then looking at the kill claims that you have on there to see if it kills the thing that you're worried about. So right now, if you're very worried about influenza and influenza A and B, because that's what's really circulating in Canada right now, you want to make sure that your disinfectants have that particular claim. If you're worried about coronavirus and you're one of the few facilities in Canada that has been asked to look after a patient with coronavirus, then you want to make sure that at least you have a broad spectrum virucidal disinfectant, and that can come in many forms. It can either be a hydrogen peroxide or it can be a sodium hypochlorite, aka bleach. So it totally depends on what you have, but then the DIN is your friend. The DIN is your friend because it really lets you know what you have as a starting off point, and then your label of what the product kills is your other friend. So make those two your go-to to verify stuff.
Great, thanks, Barley. Should proper disinfection include underside of hard surfaces such as cafeteria tables?
That's a great question, because I guess it really needs to happen where people touch, right? And often people do touch the underside of tables in those areas. I would tell you it's a great opportunity to introduce the tool of electrostatic disinfecting there, because of our technology. We wrap around and get in under those areas that traditionally you wouldn't have the time to clean, because we do have I guess a tendency to focus on the visual pieces, right? The ones we can see, and you can't always see where the germs are, and that's why it's good to augment with a tool like electrostatic disinfecting.
Great. Are there any studies published regarding the effectiveness of electrostatic disinfection? Is it effective against C. diff?
Okay, great question. In the end, I'm gonna hand it over to Barley, because we do have some exciting news coming in that area. I've spent the last 6 to 8 years creating Canadian data with the use of our electrostatic program with our good people at Clorox Pro. And so I have all kinds of Canadian data that clearly illustrates that it works and we're doing a lot of great work in acute right now, Barley and I are, as well in long-term care. And we have a whole raft of education customers, as well as professional sports teams, things of that nature across the country that are using these tools every day very effectively. Barley, I think you may want to touch on the C. diff question.
Absolutely. No, thank you for that. And I think definitely there's a couple of studies that we have right now in development and more to come. If you Google Dr. called Curtis Donsky, he's been one of the leading authorities to do some research coming out of the U.S. So Curtis Donsky has done some research coming out of the U.S. related to the T360, in addition to all the amazing work that Dave and his team have been doing. That has allowed us to get studies from schools and many other settings like that. I think there's a lot of material there. That being said, when we came out with this technology, I think initially we only had one particular chemistry. We've started to learn a lot from the customer. The people in different institutions have been asking for different chemistries that can do different things. So we are coming out with in June, we're coming out with our sporicidal product that will have efficacy against C. difficile and other emerging concerns like Candida auris. So you will be able to use the electrostatic for management of your C. difficile and your other sporicidal needs. So that's actually something that is fresh out the press, and we're really excited about that, and that more to come on that.
That's going to be a game changer for sure.
Great. We just have a couple more questions. If you're dealing with an identified breakout, would washable cloth systems still be used, or would it be a one-time use cloth to maintain the breakout?
Sorry.
No, after you.
Okay. I've seen it go many different ways. Like I've seen certain facilities actually implement microfiber and have proper laundry process and have good outcomes. At the same time, I've seen certain facilities have reusable rags and have poor outcomes. So what we are seeing more than anything else is we have like the facility that we have is ready to use the wipes on the ready just for an outbreak, and then they'll deploy them and then their outbreak goes away. So really, at the end of the day, if you look at PIDAC and its direction, both are considered fair game. If you're using ready to use, you can actually just use it as per the manufacturer's instructions and make sure it's not drying too quickly. If you're using rags and other things like that, you want to make sure that your laundry process is ideal. You want to make sure that the disinfectant liquid that you're using is not binding to the rag or the cloth material that you're using. So you've got a bit more work that you have to do. But both, if done right, can have good outcomes.
Yeah, I was just going to add, the laundry is the critical piece, right? In many of the successful microfiber programs, we're able to successfully get them clean and reuse them, and we're using ideally one cloth per space as we clean it and so on. But the laundry is the critical piece. If it doesn't get washed properly, then you have a whole other series of problems you're trying to deal with.
Okay, great. And we have two more questions here. So in a pinch, how effective is vinegar?
That's a very good question, because I hear that I actually have heard that question even in hospitals when the patient has left and they have got multiple complexities, and then the question comes up to, hey, I use vinegar at home, can I use it here? Here's the thing: when you're in a public setting, or if you're in a healthcare setting, then that comes with its own consideration. Vinegar, from a chemical name perspective, can be called different things, but it can also be called peracetic acid. When you're dealing with vinegar, your concentration matters. So if you have very, very high concentrations of peracetic acid, you can have very good disinfectant. But most people would be using their vinegar that they normally put in their chips, and that one there, or fried, chips, I'm using my colloquial term here. But normally you will not be able to get the necessary contact time or the ability to kill that's required. So in that particular case, vinegar then becomes something that is not ideal. But if you're using it as a chemical like peracetic acid, and I know some companies have a peracetic acid, in that particular case, then it will have efficacy that's required.
Yeah, and it's funny, that's my exact saying, vinegar is for French fries, right? It's, the reality is, it's been around for many years in the cleaning industry and used for a variety of things. But if you have no way of understanding what that percentage is, or how to measure it, or how to effectively decant it or dilute it, then it becomes a bit of a tool that could cause more damage than help. And we see it in neutralizers, we see it in parasitic acids, where materials are specifically designed to take on a task, and unless it's set up that way, vinegar's for French fries.
And I'm hungry now.
Yeah, it is lunchtime.
Great. And so we have one more question. Can electrostatic disinfection be used on toys and books?
Yes, it's a great tool in daycares and things of that nature. Although certain food chains, the playlands are disappearing. We're utilizing in areas of that nature. There's still some in some of the larger retail stores. Things are treated. We've been using it effectively in daycares and JK and things of that nature. Like all disinfectants, if you read the label, it'll say after things are treated, toys should be rinsed with potable water in a lot of cases. But as I say, from that standpoint, we've been able to apply the disinfectant and not necessarily have any concerns.
And the other thing too, I think that we're looking at right now is we're definitely, as I said before, we started out with one chemistry that could do a lot of different things. We're introducing the sporicidal chemistry, and that would allow you to clean and do your work disinfectants. We're also going to be introducing a food-safe disinfectant, food-safe sanitizer that will allow you to manage all your areas where you have food, and that is actually something that's good for even daycares where kids might lick surfaces and so on. So there is more chemistries to come, and I think as that kind of those chemistries come, they can also be used more widely in certain areas that you might not be able to use your harsh disinfectants today.
Okay, great. And we actually have one last question, and that's regarding the concern about the Clorox Total 360 chemistry not having CFIA approval and then being used on surfaces such as the cafeteria table.
Okay, great question, and I guess it is sort of a two-part answer. We can certainly use Clorox T360 solution on cafeteria tables. There's no reason not to. CFIA applies to chemistries that would be used to clean effectively a food preparation area or a food processing area here in Canada. In fact, we do have an emerging chemistry coming sometime this year, which will have CFIA approval. And it will fit in the same platform as T360, but you can use the current version of T360 in the cafeterias, in dining areas with no concern. The CFIA registration applies directly to materials that would be involved with the preparation of food and the handling of food and processing of food.
Great. Thank you so much. So that's all the questions we have. Just a reminder that we will be sending out our outbreak prevention guide, our hand hygiene program guide, as well as a recording of the webinar. Thank you so much for your time.